My daughter had come to Dr. Tollestrup with some problems in her leg a year ago, and she suggested that maybe I see him to see if we could do anything.
A lot of orthopedic surgery is done very close to peripheral nerves, and orthopedic trauma and even orthopedic surgery, things like joint replacements, are a little bit sort of rough by their nature. I mean, if you have to replace a joint or fix a bone, or the trauma that goes into causing some of these orthopedic injuries in the first place can often injure the peripheral nerve at the same time.
I hobbled in one morning and walked out immediately after without any severe after effects at all. No more leg cramps, no more pain in the back of the knee. It was really severe at one time, but that is long since gone. Very satisfied with things.
It's very common actually for me to be in the examination room with a patient who's been brought there by a spouse or a son or a daughter, what have you, and for the person who's just sitting there passively to pipe up and say, I've got this pain, or I know somebody who's got this pain. So my sort of mantra is that everyone either has a peripheral nerve problem or knows somebody with a peripheral nerve problem. And that may be overstated a little bit, but it's not too exaggerated, because literally if you think about who your circle of friends, especially if you're older than 40, the odds are very high that if you have a chronic pain problem that hasn't been solved, you have a peripheral nerve problem, or somebody who's dealing with a severe chronic pain problem that's likely to be peripheral nerve.